flip, you skip, you pip, you strip, you drip, you trip, you whip, you kip, you flip, the flip, you flip, the script, you flip, the script, you flip, the script, flip, the script, flip, the script, flip, the script, flip, the script.
Hi, I'm called Grace Linda. Have you subscribed to our YouTube channel? If you haven't, it's called Flipping the Script. Please subscribe. Let's check this out.
We are flipping the script on mental health. Very informative, very exciting. We have Dr. Zara with us today, and we were going right into post-traumatic stress disorder.
Yes.
So could you tell us more about this? Because this really affects so many people in various ways, actually. It's not only affiliated to childbirth and all that. Whichever trauma you go through, the post and how you deal with it is what we want to know.
Right. So with post-traumatic stress disorder, or what we call PTSD for short, so it's a trauma and stress-related disorder.
Yeah.
And I think it's very key to talk about it for Uganda, given the history of where the country has come from in terms of, yes, you've been through a lot of trauma, you know, as a nation. So there's actually a number of researches that have been done by part of the Department of Psychiatry that people can look up, which is very informative, and has looked at PTSD among Ugandan citizens post the wars. So with post-traumatic stress disorder, first of all, there's usually an exposure to some form of trauma.
Yes.
Okay, and this trauma can be anything. It could be childhood trauma, so it could be anything from physical abuse to sexual abuse to even emotional neglect. People who work with seeing a lot of what we call gruesome things, so police officers, soldiers, forensic experts like pathologists or coroners, you know, work with dead bodies. First aid teams, like first respondents, you know, so firefighters also, yes, they're actually at more risk.
Let me just ask a question. You know the people who, like, she went through PTSD after birth of her child. How come people actually, okay, I don't know how they move from not having it and then they actually give birth again. Isn't there a fear of going through the same process or same?
That's a good one.
Because there's also, okay, just to complement what she said, there's also, that takes me back to that whole hormonal thing, because sometimes it's also affiliated to certain hormonal imbalances, especially the one after childbirth. Because it doesn't necessarily be like, okay, there's a trauma there because you're scared of the whole process of childbirth, but there's also a hormonal element to it.
Oh, that when the hormones change?
Yes.
So that's especially common for postpartum depression, but with PTSD following childbirth, I mean, it would have to be
Trauma.
pretty traumatic, you know.
Like you lost so
yes,
much blood.
and with trauma, I think people tend to forget that trauma can be psychological. They seem to think trauma, when we say trauma, it's physical. Trauma can be psychological, you know. So again, like the child we use as an example, the child may not have been physically the one who was abused, but seeing that abuse in the house to someone else, that is psychological trauma. We've had women though who don't want to give birth after. We've had very few of those cases I've seen in my short years practicing, but we do have women who once they've received mental health care, because we have psychiatric units back home. Once they've received mental health care, they're open to being pregnant again and they're open to giving birth. But most of them will say, I want a C-section. I want you to knock me out. I don't want to go through that again, but I want a healthy baby. Yes, so I don't want to be awake for this. I don't want to go through what I went through, which is a natural response to trauma.
Yeah.
I wanted to point out that what Linda was talking about is the PPSD. Yeah, the postpartum.
Okay.
Postpartum.
Yes, they're different. There's just the post-traumatic stress disorder, and then there's the postpartum
Okay, so
stress disorder. Those are totally different. One is affiliated to childbirth. The other one is affiliated to trauma.
yes, so with pregnancy, there's a lot of changes in the body. You guys are mothers.
Yes.
You would know. You've probably read about it. You have children, I assume.
Yes.
He's a mother as well. He's a mother. He's not he's both.
Oh, great. Yes. So
Time.
When he's
yes.
with us, he takes on the
I'm
mother
speaking to the
because he's
perfect
with
people.
mothers.
So there's a lot of changes going on in the body, and a woman is especially vulnerable, you know. First of all, in general, her immune system goes very low, you know. And then there's so many things to think about in terms of her general health and the health of the baby. It's a very, very brave thing women are supposed to go through. So being in a position or being in a situation to have to undergo any sort of trauma increases the risk of further mental health problems in women who are pregnant, right?
Yes, that's
so it can be anything from a depressive disorder to an anxiety disorder, highly unlikely to be psychosis unless it's postpartum depression with psychosis or postpartum psychosis. But usually it's the commonest disorders, which is depression and anxiety, that we're most vulnerable to.
It's very important. My other question is, while this person, this mother, is going through this, how does it affect the child? Because we've seen very many...
I'm very glad you brought that up, given that we talked about autism and neurodevelopmental disorders. And then you also hinted on something like genetics.
Yes,
genetic
great.
disorders. So first of all, almost apparently now we know almost anything can be genetically transferred.
Yes, just hold it right there. Well, like what I meant to ask was, we've seen cases where they say, oh, this child was lost or died because of negligence. Would you relate it to probably the mother going through that?
Yeah.
And then they actually don't care for the child. They don't mind the well-being of the child because they're also not well.
So with
the many ladies who throw the babies in the
Yes.
as part of
Yes.
post-traumatic.
Or let them cry.
Going back to like our mental health awareness and stigma, again, it's very difficult. We tend to not generalize, okay? So we're not sure, it's a case-by-case basis, okay? We're not entirely sure if all these mothers have had issues or not. But one of the things, I think we stopped using this term in scientific lingo, but we still use it, postpartum blues.
The baby blues.
Aha, see, now I'm talking to people. Yes, so the baby blues are actually very common, you know? And a lot of the time, especially with first-time mothers, you know, it becomes very, very, you're worried, you know, you don't know what you're supposed to do. Even though your mom is there, you're like, yes, your mom is going to leave, and you're like, but I'll be left with this thing, you know, yes, you know. And everyone's just telling you things like, but just feed the baby, just change the baby. But I'm doing everything. It won't stop crying. You're like, it won't stop, you know. Yes, so that in itself adds to the stress. Okay, so you have the hormones that are just all over the place. They're trying to just balance themselves out, you know. You've been through childbirth. First of all, whether, I applaud women anyway, whether you've been through natural childbirth or C-section, you've given birth to another human being.
Yeah.
They're both stressful in their own rights. So you've gone through either of that, right? And then you're home, first-time mother, you're struggling with producing milk and that type of thing, right? So you're already in that risk factor for the blues, right, with all that. So when you add on not being able to care for the child, so now if we haven't given you someone to talk to, sometimes it's really just the pediatrician that is treating your baby, you know? And my friend's pediatrician actually asked her, how are you feeling now that I'm done checking on your baby? And I loved that. I loved that.
You know, you have to check with,
I think they have
to
incorporate
with
this
the mom.
kind of training.
You have to check in with the mother, you know? So that can prevent from postpartum blues, that can prevent postpartum depression. Or that stress-related issue that we were talking about.
Because it's all about the baby at that time. Everyone is giving attention to the baby, even your husband.
Yes. So sometimes they forget that
you get into a depressive
state. We have to take care of you.
Yes,
so
the men feel left out
if
now.
not treated, that can lead to neglect. And in severe cases, neglect is really bad, but in severe cases, there are mothers who are so depressed, other than being suicidal, they're homicidal.
Or they will kill the child.
They'll attempt to kill the child, or they, unfortunately, will succeed in killing the child.
As a doctor, what would be the pointers to you when, let's say, this child, if the child is not dead, how would you know from the child the symptoms they would present that would lead you to believe that the mother is suffering this PTSD or something blues, or what would be from the child?
Okay, so generally when you watch a child and you watch the way they interact with people that they know and they interact with people that they don't know, the strangers, right? Yeah. So you want to watch the interaction between the child and their primary caregiver, and you also want to watch the interaction between the child and you. Most children, when they have their primary caregiver and they have formed a secure attachment to that primary caregiver, will wander around the room as long as they know I can go back to my safe person, right? And when you talk to them, they may seem shy in the beginning, but they slowly let out. You give them toys to play. Not even toys. Children will pick up a water bottle and somehow find something to. So imaginative play is what we're looking at here. So when a child doesn't have that, you can see that either they're not comfortable with the parent, despite that person being the parent, you know, they're very reserved. They don't get up to play around. They're very withdrawn. Okay, you need to start thinking, am I dealing with something that's like emotional neglect here, or am I dealing with an actual disorder? Because ASD can present like that. Am I dealing with abuse? And for children, you always want to find out if there is trauma. So if there's abuse, if there's neglect, if you know they're not being fed well, you know, if they're not getting the things that they need, you know, as a child, usually they're just free and carefree and doing whatever they want, you know.
And you know, you can read a lot from children.
And children don't lie. That's the thing about children. They just don't lie. They're like little open books.
I think there's something we forgot. I wanted to ask, now that we're on the subject of children, I wanted to ask about the imaginary friend.
Yes.
The imaginary friend, do adults also have that? Like someone they talk to, someone...
It would be highly unlikely.
You know, that would mean, I'm thinking bipolar and psychosis.
I would be worried if an adult had an imaginary...
Yeah,
let's talk about the imaginary friend of the child.
Okay, so children, like we talked about imaginative play. Yes. You know, you give a child a doll or you give them a car, they'll enact something, they'll act out something. So these are themes that we get, yes? And after a certain point, though, we expect, you know, as they're maturing, they phase out of different things, you know? So currently, adolescents are more into, I guess, video games than as opposed to playing with dolls and trucks, yes. But if they don't phase out of that, then you start to worry a little bit.
Yeah, I really would not encourage, I would really not encourage for parents to encourage imaginary friends, playing with imaginary friends. Like you said, they're dolls, they're toys.
I think it happens, but there's a point where you should be worried.
Yes.
Yeah, when there's a certain
by like 8, 9, if I'm not mistaken.
Like
by like 8, 9, it usually phases out because that's the age when you look at the psychosexual development. That's the age they figure out, hey, there are other people around me that I can interact with and have meaningful conversations with at the child's level of meaningful conversations. You know? Yes. So they figure out, and especially for they figure out same-sex type of friendships. You know, they're inquisitive about other things. So that's when they're like, okay, a rabbit. So they're more likely to follow the rabbit or the kitten or the puppy than the imaginary friend. You know.
Oh, that's the point where they actually start to ask for a pet at home.
Yes. So that's the point they start to ask for a pet at home. That's the point where they say, you know, mommy, I'm old enough to wash the dishes now, so I'm gonna wash the dishes.
Or they want to take up responsibility.
You know, yes. So they feel like, okay, I'm very independent now. I'm more independent than I was when I was 2 years old. You know,
and this is quite interesting.
If they haven't given up the imaginary friend, you really want to think about abuse. Right there, you really want to think about abuse because the imaginary friend provides a safe space for them.
Yes.
Dr. Zara, I really wanted to, before we wrap up, just quickly to tackle two things.
Yes.
OCD, number 1.
Yes.
And there's a very interesting thing called kleptomania.
Kleptomania, yes.
Yeah?
Yeah.
The petty stealing, someone that can afford almost anything but just keeps on stealing. Yeah, the most inexpensive thing.
Either you know someone? You seem like you know someone.
I'm just thinking out.
Yeah, they're always stealing. I mean, you have them over to your place and they'll pocket the spoon, the cutlery, you know.
House party,
and this person can afford even more expensive cutlery. But it's very, very interesting to know that such people exist.
Yes,
and we want you to explain why that could happen and how they can be helped. But first, let's go to OCD, the Obsessive Compulsive Disorder.
So obsessive compulsive disorder, and I'm very glad that the DSM our scripture that we talked about, separated the category for obsessive compulsive disorder and other related disorders. Previously, it was under anxiety disorders, and while it does have an element of anxiety and anxiety symptoms, it is in its own right fully fledged disorder. So as someone with mental health
Challenges.
yes.
Hello,
You
my name is
kill,
Abby.
you flip, the
Have you
flip,
subscribed to our
you flip,
YouTube channel?
the script,
If you haven't yet,
the
please
script,
subscribe.
the script, the script, flip.
I'm actually, I'm living with OCD. I'm living with obsessive compulsive disorder, and I'm living with another OCD-related disorder called excoriation, otherwise known as pathological skin picking. So, Abe knows what I'm talking about. He immediately went to his behavior. He immediately went to his behavior.
I have a bad
So,
handwriting.
other than that, so with pathological skin picking, there's repeated
Picking at your
picking
skin.
of your skin. So I have a number of scars. So it can be anything from the lips. You know, when you have dry lips, usually there's the
you're
skin that peels
peeling.
out. It could be the skin itself. It could be the side of the nail beds.
Cuticles,
Yes,
yeah.
cuticles. And then there's also
Before
something
you
that's
go on,
interesting.
it
Yes.
should be repetitive.
Yes,
If it's
it's
a one-off
usually
or
repetitive.
if you don't
It's
start saying, oh my
repetitive.
goodness, oh my goodness.
And usually there's a feeling of like internally there's a feeling of like you can't control it. You must do it. So that's essentially the compulsion, the motor act. People who have what we call trichotillomania pull out hair.
The hair, yeah.
And it can be very distressing again. Imagine having patches of hair or not having parts of your eyebrows. It is very distressing. These disorders usually begin, again, at around childhood and adolescence. Yes, so we will talk about something you mentioned earlier about prevention of mental health issues and mental illnesses in general. So with OCD, you essentially have two parts, the O and the C. And that's how I like to break it down, right? So the O is the obsessions, and the C is the compulsions, right?
Yeah.
So usually compulsions are driven by the obsessions. So a very good example of thinking about obsessions, instead of going through a whole scientific definition, is if I touched something or if I shook someone's hand and I don't know where it's been. So then what's going through my head over and over and over and over and over again is germs. And then I'm going to touch my face, and then I'm going to touch my lips, and then I'm going to get an illness, and then I'm going to get an infection. You know, so it's very vicious. So then the compulsion in relation to that obsession is I have to wash my hands.
Or get a sanitizer all the
I have
time.
to hand sanitize, right? And it's usually repeated, and
Yes.
it's very distressing. It's very time consuming. Yes, so it's what I like to call it for my symptoms. Everyone goes through it differently, and they have different themes. I have quite a number of themes that I'm working on. I call it that annoying song stuck in my head, because ideally, patients with OCD, you know these are your own thoughts.
Yeah.
They're not foreign. They're in your head. You know that. But it's so difficult for you to get rid of them. And then the compulsion, while it serves as a relief, it's only so brief. It's a very, very small moment,
Yeah.
you know?
You wouldn't die.
And then it's done. So then that relief is gone, and then the obsession comes back.
Back again. Oh.
Is there a part where you say, you know what, instead of all these germs, I won't shake people's hands?
Yes, it gets that severe sometimes.
Like,
Yeah, like I don't
there's
shake
But then
there's a celebrity
at the
who
expense
doesn't
of,
shake
you know,
hands.
at the expense of,
How?
again, societal norms that we need
Yeah.
to conform to sometimes, at the expense of looking like
Socially
you're
awkward.
crazy.
But I wanted about
Instead of
OCD.
shaking hands.
About OCD.
Yes.
You know, for the longest time, like, okay, I know people keep on saying my OCD. Like, most of my friends think I do have that, but you know why I got to know that it's not OCD? I can still see things that are not right. It will bother me, but I will just let it be sometimes.
As long as you
I'm a
can let it be.
perfectionist, and I use that a lot. Perfection and OCD. Yes, I know a person with OCD
They're closely
will
related, though.
want a lot of perfection around them. And if
So,
things are not going perfectly,
Interestingly, that's actually OCPD, which is a personality disorder, which is
Yes.
obsessive compulsive personality disorder. Yes.
then like it won't bother me. Yes, I will identify that thing is not right, but it should be right. But I won't like I won't lose myself because now it's not right. I have to go put it right. You know,
hangings which are
yes, that are a bit
off-center.
crooked. I'll say, I'll fix it. I have noticed it's not right. I'll go fix it, but I won't go around saying.
Are you trying to tell me?
Yeah. I won't go around saying, oh my goodness, I have OCD, If the cake is not cut, you saw that cake thing. If you want to piss off someone that has OCD, cut the cake the other way around.
Ask you.
Yes.
So people tend to do that, and you find like threads or posts online where they're like, if you're a perfectionist or if you have OCD, the following images may, frustrate you or that type of thing. It's not necessarily that.
Yeah.
So I highlight a little bit on themes. There are multiple themes for obsessive compulsive disorder. So at the end of the day, we go back to our definition. If it impairs your productivity, if it is distressing and impairing, it is a problem then, and it requires obviously very important, significant intervention. Right?
Very quickly, kleptomania.
Yes, so kleptomania is one of the disruptive and impulse control behaviors, along with pyromania, which is impulsive fire setting, which isn't very common in our setting. But back to kleptomania. Kleptomania is actually very interesting because I've never met a patient with kleptomania, and I would like to. Not that I'm hoping someone has kleptomania, but it would be interesting for learning purposes.
Many.
No way!
People who like to pick things.
You have to introduce me. We need to see them. Yes,
I know one. They stood out in the whole country.
Wow.
I won't mention.
The actress that used to keep going, Winona Ryder.
Winona Ryder, yes.
Yes, and people were wondering. She kept picking at small things in shops, in stores, yet she's a celebrity, made lots and lots of money, and there are these street people
and
that
by the way,
cannot
they pick
do
small
that.
things.
I
knew a
things that you
person
can
who used to
hide,
take
yes.
cutlery.
Yes,
Cutlery.
Yeah.
Cutlery is very common.
Books,
Cosmetics are very
novels,
common.
Cosmetics,
Underwear is very common because it's very easy to like fold it and it's very easy to fold a little bit of panties and like stuff it in your pocket somewhere. It's very easy to do that.
Okay, now we have so much to talk about. We're going to have Dr. Zara back here with us.
We need her back.
There's lots
I would love to
of
be
disorders
back.
that we haven't mentioned. There's the eating disorders, which are very, very important, and we haven't mentioned. I also read about sex addiction being one of the impulse control disorders as well, just like kleptomania and the binge eating.
It's understudy, yes. Sex addiction is currently understudy, and so is video game addiction.
Yes.
However, we do have behavioral addictions such as gambling.
Gambling as well. Yeah, that's
which
what
is very
And
disruptive.
Yes, and
social
phones.
media.
Yeah,
And
there's
your phones.
so many
so
guys.
much.
Social media.
We're going to have lots and more because we're out to, as flipping the script, we're out to create mental health awareness. So we want to have to invite you again. Please say yes right here now.
Before we go, she's in Butabika Hospital doing some outreach or something.
Yes.
I would like us to tell the people where they can go. I know for a fact that Butabika Hospital is the #1 referral hospital, national referral hospital for mental health. But it also has, when you say mental health, people definitely go to, she's mad, Olimulalu, and what. But they actually have a substance unit, alcohol and drug unit. Worked with Dr. Alice.
Yes.
Yeah. And you can tell us more about that. And maybe 2 or 3 other centers that people can go to. There's also Strong Minds.
There's You Belong also.
Yeah.
Yes.
Even Serenity
as well.
You also mentioned that you haven't met anyone with kleptomania. If anyone out there is struggling with kleptomania, Dr. Zara, can
Please
hear you
repeat
out.
for them what kleptomania means.
Impulsive stealing.
Yes, it's impulsive stealing. Stealing
can't
on
control
impulse,
it.
and
You can't control it,
it's repetitive. You can make, if it's a one-off, and I mean, you're tempted by the devil, that could be something else, yeah?
But if the devil comes too
impulsive,
often,
repetitive, if the devil is visiting you way too
whispering
often.
too much.
Edda bagamba nti omuntu alina engalo engalo z'empanvu.
Yes. Do not burn them up. They may need rehabilitation. They may need to speak to a specialist. So please, Dr. Zara, could you tell people where you can be reached and where else people can go for mental health help?
Right. So we have a very competent, very good department that I'm really glad that I'm a part of as a resident.
Yeah.
We operate primarily in Mulago, but if you would like to see any of the specialists at their own clinics, they would be glad to offer you that information. We also operate in Butabika National Referral Hospital, and the outreaches that we do, we have some in Maganjo, we have some in Nansana, and I'll leave the rest of the list and the specific days with our hosts. One thing, as we're wrapping up, I would like to reiterate to everyone who's watching, there is no shame in going through a mental health struggle. It doesn't mean you're ill, and even if you are ill and you have an illness, then there is help out there. And I like the fact that I'm learning a lot. I mean, I'm just your neighbor, I'm Tanzanian, but I'm learning a lot from Uganda and the way mental health has evolved and progressed over the years and the people that have advocated for it. So I, first of all, applaud the three of you for this and the whole team. And I'm just going to keep saying advocacy, advocacy, advocacy. The absence of a diagnosis is not the same as the absence of a problem. So reach out. And there are connections. People are learning things. People are being aware, you know. So if you don't know where to go, just start by someone close to you, and they would know where to go, where to go, where to go.
Is there a particular website, perhaps?
Not that we have at the moment, but there are a number of social media websites.
Yes, please.
That I can share. I have a few of them where people can have easy access.
We'll
But
have that.
I think
We'll
those
have
will be
those
running
on our social
page.
media
Yes.
pages.
Social media pages.
Of flipping the script.
Yes.
If you haven't visited our pages, flipping the script on Facebook, script_flipping on Twitter, and flipping the script on Instagram.
And we can continue this conversation, by the way.
Yeah,
on the
right
pages.
there on social media. It made it so easy. Dr. Zara, thank you for being here. I love the way you said Maganjo and Nansana. High five to that.
I'm
Ugandan, you're no longer Tanzania.
I'm completely Ugandan, you guys. I'm
Thank you,
completely
guys.
Some people say Kampala instead of Kampala.
Thank you so much.
Kampala.
Thank you.
Next time.
Thank you.
Hi, this is Elle. Have you subscribed to our YouTube channel? Please subscribe to Flipping the Script so you don't miss out on anything.
You whip, you kip, you flip, the flip, you flip the script, you flip the script, you flip the script.